A really common question that I get is, what is the difference between an RGP and what we call a scleral contact lens? So I thought that I would go through some of the main differences and show you the different lenses. First of all, it's a little bit of a misnomer, okay, because an RGP actually stands for rigid gas permeable lens, which a scleral lens is made out of rigid gas permeable material. So they're both technically, they both fall into this RGP category, but nobody calls a scleral lens an RGP because it's a much more complex design than that. What we refer to as an RGP is a small diameter hard contact lens made of rigid gas permeable plastic. So just to look at the sizing, here's an example. This diameter is 9.6 millimeters. So about that big. Okay, so you can see this is kind of small. So compared to even a soft contact lens, which is usually around 14 millimeters or 14.5 millimeters, this is 9.6 millimeters, and these can go even smaller, like to 7 millimeters, 8 millimeters. So when would I use an RGP? Anybody who has corneal scarring, an irregular astigmatism, even keratoconus can benefit from an RGP. The downside of them is that they're uncomfortable in the beginning. It takes a bit of time to get used to them because they're so small, they sit directly on the cornea. The cornea is the very sensitive tissue. That's why when you get like a speck of dust or an eyelash in your eye, it's very painful because there are so many open nerve endings on the cornea that you feel everything. So it takes some time to get used to them, but I'll tell you that patients who need them, within a month or two, they don't even feel them in their eyes. The next category of lenses is a scleral lens. So I want to show you two different sizes of a scleral lens. And the main idea of a scleral lens is, like its name, it's an RGP material. So it's a hard plastic, but it does not touch the cornea at all. It touches the sclera, which is why we call it a scleral lens. The sclera is the white tissue of the eye. Okay, and there's no open nerve endings on the sclera, so it's a much more comfortable lens. Every curve of a scleral lens can be customized. It's a much larger lens. And then, so here's an example. This is a 16.5 millimeter scleral. Okay, and if you can tell, it's actually, it has a cavity. So you fill this lens up with solution, with preservative-free solution, a special solution that goes inside here, and you put it in at a 90-degree angle like this. That solution bathes your cornea all day long. So these lenses, when they're fit right, are very comfortable. They also provide excellent vision for people who have an irregular surface, either from keratoconus or something like that, just because they cover a much larger area. They're much more effective at fixing those levels of astigmatism. There are other sizes of sclerals. The whole concept of a scleral is that the rim is landing on the scleral. So you can go super small, like a 14.9 millimeter, that would be called a mini scleral. You could go up to a 21 millimeter scleral, depending on the patient and the needs. So anyway, that's the main differences between sclerals and RGPs. They're all great, but it's so nice to have all the different options available that we can choose depending on the patient's needs.